So how do you actually teach someone with no medical background to do dentistry?
That's a very good question. I suppose you start with the absolute basics, and you think about the fact that if they haven't had any sort of medical or dental background at all, what do they already know? And you start building on that. So first they need to be observing you. Once you start to take some teeth out, you can start to show them what the anatomy of the tooth is like, where the roots lie, how far deep they go. You try to explain where to aim for when it comes to anesthetizing or numbing of the mouth, how to check that the patient is actually numb with a probe, because we want to not only be providing safe dentistry but also comfortable enough dentistry so that patients do come back and we're actually helping people rather than scaring them off.
Of the dentist.
Yeah, that's very important. I remember last year when I trained somebody, I had to summarize or condense 3 years worth of oral surgery that I'd learnt at uni in 3 hours.
Wow.
Cabo over there is the person I was talking about earlier when I said we did the training of 3 years of oral surgery in 3 hours. Extremely sharp and smart, superhuman learning speed.
Right, we're off to the opening ceremony where we do further formalities. Yes. Yeah. Introduce ourselves once again and what we're here to do.
Good morning, Panama. My name is Dr. Gaz Radi. I'm the lead dentist of this team, and I look forward to working with all of you.
Good morning, Panama. My name is Mohammed Naji. I'm a dentist from the UK, part of Dr. Radi's team. And I look forward to working with all of you. All right?
It is a pleasure for me to welcome my fellow diasporans and friends of Sierra Leone to be back home.
So we have finally got to see our clinic, and in this particular case we got a therapist that already works there, carrying out simple stuff. The idea is to work alongside, to pass on our knowledge. We'll make it work.
Indeed.
We'll make it work, Sultan. When I opened up the equipment that I'd brought over from the UK, I realised that we did not have the full set of forceps. 1, 2, which I'm a bit annoyed about. I'm a bit annoyed with myself because I should have checked them, but then there should have been a full set. But then that's an example of, just one example of working in this environment. You have to think outside the box all the time.
We're going to clean all surfaces. Anywhere that is touched needs to be cleaned. Otherwise, you get infection. Very intense. I think it's getting a little bit cooler now, but been a very intense, hot and humid day. We've had AC on there, but a lot of people in the same room as well. Over there, there's there's autoclave. Autoclave them, bring the instruments back here, nice and clean. The main focus of today, at least for me, has been not only training the guys we've had from the past couple of missions, but also to get some of the more complex ones done myself to show them what they could or can't be doing, and to record the data and make clinical notes. NAD. That's it. I'm constantly asking them questions. I'm also giving them tasks to give the post-operative instructions, to do the local anesthesia, to do the extractions themselves under my supervision, and Dr. Tarawali and Dr. Radi and any of the dentists that we have on the team.
So we had the patient that suffered an accident, a road traffic accident with multiple fractures, blind in one eye, and a very critical state. We had Dr. Tarawali, who examined him and did an assessment, and we're going to send him to, as a referral, to the hospital in Freetown. How that goes, we don't know, because he's been here for 5 days and he hasn't even been on intravenous antibiotics or anything. This is the situation we find ourselves in.
My name is Dr. Karifala Tarawali. I grew up in Sierra Leone, but went to study dentistry in Russia. After that, I went to the UK to further my studies. I lived and worked there for 22 years. Last year, I moved to Dubai to work for the American Hospital Dubai. I've been doing this work here in Sierra Leone since 2017, working in collaboration with AMRAN and IOM. It is a challenge. But what brings me back is that I grew up in Sierra Leone. Both my parents were dentists, and I was aware of all the challenges present. Coming back, I was hoping things would have improved, but it seems the challenges are still there. Overall, I have to say the organization has been very good. Everything's gone smoothly so far. We've started working actually in the afternoon. Our first patient was very challenging. This is a patient who suffered a road traffic accident. At the moment, referring to the right department is proving to be the problem. Other than that, work is going smoothly. We have some people we are training here with Gaz's team, and that seems to be running very smoothly. A few times I've had to interfere to help out, but otherwise it's going to plan.
We've just had some inmates in from the local prison, and we're treating them for mainly extractions. Yeah, that's our first day. We'll see how it goes.
Deep breaths through your nose. Keep breathing, okay? Deep breaths. Well done.
Are we done, Dr.
Well done. No, he's going to come here, and we're going to make sure that he stops bleeding. So he's biting down on the gauze. He can slowly come here.
It's a very tiring day. Obviously, we're trying to get to the rhythm of things, trying to sort of rearrange the dental surgery, where the clean stuff goes, where the dirty stuff goes, and working out where the decontamination can be done. A lot of them came from the local prison. Yeah, it's been a bit hectic, but the boys that are present are really eager to learn, and they seem to be picking up things very quickly. So in this situation, the reason why we don't like to do that is because I'm going to do something called a nerve block. This whole side will be switched off, okay? All in all, I'm pretty happy with what's happened today. I mean, obviously, it's a bit sad to see how things are, but this area, they're considered lucky because they have a dental unit, or at least an allocated room for dental treatments. The young sort of nurses that are training to be dental therapists seem to have a good hand. Didn't get in the way. We just basically helped them, topped up their supplies, gave them newer kits, explained some fundamentals when it comes to surgical extractions. And all in all, I'm very happy with how it went, and hopefully tomorrow we can do more.
It's just been a very intense day of seeing patients, recording data, taking teeth out, managing complications. The conditions here are very limited.
Of all the places to drip, it drips on that.
A language barrier itself is a bit of a challenge. Do you take any medicine? Tablets? But we do have members or therapists from before that do speak the language and can get the correct information across. For example, we don't have access to suction, we don't have access to x-rays, and we're very limited in terms of what we can prescribe to patients as well. So we can prescribe antibiotics and some painkillers, but not much else. We don't really have access to drills either. We do have a mobile dental unit. That's something that we can't even train the therapist on because it's not something we can leave behind. So we have to take that one back, so there is almost no point to teaching them how the drill works or how to do a filling, for example, where there are so many more basic steps that we need to teach them before we get into saving teeth as well. But yeah, I'm trying to keep it all together, trying to keep smiling through the day and not let the exhaustion or the back pain or the frustration of sometimes things not working get to us, and we'll just keep a positive attitude and just keep going.
The rest of the team is good. Everybody is positive. Things are moving on, so I'm very optimistic. Our stay here will be one of the best so far. However, we expected to travel to a town further into the provinces called Panguma, and I don't know what facilities are present. I suspect that is going to be challenging.
I'm hopeful that even when we've left, they could potentially carry on, even if it's to a lesser degree. We just hope that we can impart something that can carry on, at least until the next time we come here.
It would be really useful if we could have anybody who's watching, anybody's support, we'll get the links onto the descriptions and a way for you to be able to help us, because I think funding is a massive issue here. Other than that, not much else. Just wish us luck.
Yes.